Hello, dear colleagues. My voice is clear.
Yes, sir.
Thank you. Thank you for joining, all of you. We are going to start our session now. Dr. Jan, you are ready?
Yes, sir.
Okay, thank you, Dr. Ria. Yes, Dr. Jan, this is your case. Yes, Dr. John.
Okay, sir. Yes, sir.
We
Yes,
will
sir.
give you 5 minutes to start as in the exam. Okay, exactly after 5 minutes, we will start.
Okay, sir.
Yes, you can start.
Yes, sir. Can you hear me?
Yes, go ahead.
Yes, sir. Yes, sir. Hello, my name is Dr. Jim John. I am the SSO here. Can I know your name?
Yes, I'm Clark, doctor, and I'm 30 years old.
Okay, thank you, Mr. Clark. So your GP has referred to me saying that you have joint pains and tiredness. Can you tell me more about your joint pain?
Yes, doctor. Actually, for the last 3 weeks, I'm having joint pain, and it started in my right. It started in my left ankle first, and then in my left feet also, left foot, and then now I'm having the pain in my right knee, doctor.
Sorry, right knee.
Yeah.
Okay, okay. Sure. And since it had started in the right ankle, is it still persisting or has it gone?
It is decreased.
It is decreased. And while it was decreasing, the other joint, the left foot and the right knee has come in.
Yes, yes, like this. Yes,
All right. Okay. And it has been over this past 3 weeks.
yes, yes, doctor. Pain and swelling.
Okay. Okay. Any similar pain and swelling of the joints in the past?
No, doctor. It happened to me first time.
All right. All right. Okay. And does it involve the hands, in your arms, your elbow, wrist, or your hands?
No, doctor, no, no other joints. Yeah, I have
No.
pain
No.
in my lower back area also, doctor, and towards my
All,
right buttock also,
all right.
right
All
hip
right.
area. Yeah.
Okay. This pain is more in the daytime, or in the like after rest. Does it get better, or
I feel it is
uh,
more in the late night and early in the morning, doctor.
okay? So when you move around, is it getting worse or is it better?
It is bit improving, doctor. I feel like my joint is also jammed, and I feel the stiffness also, especially late night and early morning. This stiffness also improves as the day is passing.
All right. So have you noticed any particular time period of the stiffness persist? Say
No,
half an
only
hour, 1 hour.
yeah, yeah. It is staying for more than 1 hour, doctor.
All right, all right. So even the back also, do you feel stiff in the morning?
Yes, yes.
Okay, okay. And it gets better with the movement.
Yeah, it gets better. The jamming improves, but the pain is still persist.
All right, all right. And uh, did you notice any redness or any warmth around the joint?
Yes, I feel it is warmness is also there, and some redness is also there.
Okay. Have you noticed any swelling or pain in the uh, little joints in the foot over the toes?
No,
Okay, especially in the first toe, the big toe.
no,
Okay, all right. And how severe do you think the pain is? If you say 0 is the least pain and 10 is the maximum pain, how would you rate your pain?
yeah. Mostly it is 5 to 6, and early morning it becomes 7/10.
Oh, I'm so sorry to know that. With this discussion, I'll try to help you out. We'll find out what the cause is and we'll sort out the problem. So I
Thank
wanted
you.
to know more details from you. So may I ask, do you suffer from any other illness like high blood sugar or high blood pressure or any other medical condition that I should be aware of?
No, doctor, I'm not having any long-standing disease.
All right. Have you had any surgeries or hospitalizations in the past?
No, doctor.
All right. Have you taken any medications for the symptoms, or are you on any other medications?
Yes, I'm taking doctor ibuprofen for this pain, and it gives me partial benefit.
Okay. How frequently are you get using it?
Every morning I'm taking nowadays after the breakfast.
Okay. Did the GP prescribe you this, or are you buying it over the counter?
Yeah, yeah. GP has told me to start this, and he wrote the letter to you.
All right. All right. Fine. Have you had any allergies to any medications?
No,
All right. And do you use any over-the-counter medications?
No, doctor.
Okay. And do you use any herbal remedies?
No.
All right. So I want to ask a few more questions about this, about any other symptoms that are involved. So do you
Sure.
find any raised body temperature?
I feel my body temperature is on a higher side in the morning time when I'm having more pain.
All right. Have you ever
But
measure
it was,
checked the temperature?
yeah, yeah, it was recorded maximum was 37.9 and once it was 38.
All right. Okay. That is low grade fever. Okay.
Okay.
And you said you feel tired. Is this tiredness also more in the morning or is it in the evening?
Yeah, more in the morning, doctor, as the day is passing. Still, I feel tired because of this pain, doctor. My activities are still limited, although the pain is improving a bit after taking the medicine and as the day is passing, but the pain is still persisting to some extent.
Okay. Okay. All right. Did you notice any weight loss over this past few weeks?
Yeah, I notice also weight loss, doctor, like 2 kg. My appetite is also poor. I'm not having good appetite.
Okay, you're having, and I've lost 2 kgs. Okay, I'm so sorry to know that. Did you notice any
Yeah.
rash in your skin?
I feel I'm having some skin changes also, doctor. Yes.
Okay, okay. Where exactly is that?
It is in my palm. It is in my feet.
Okay, is it reddish discoloration or is it like spots?
These are the spots like this.
All right, all right. Okay. Is it painful?
No,
Okay, okay. All right.
but
Did
I
you
feel
see
this
any?
discomfort. I feel discomfort, doctor, with this.
Okay, I'm so sorry to know that. Okay, all right. Okay. And do you have any mouth sores?
No.
Okay. Any redness in the eyes or dryness or grittiness or pain in the eyes?
Yes, doctor. I feel I'm having grittiness in my eyes and my eye is red also.
All right. Okay. Has how long has it been?
It is for 2 weeks now.
Okay. Okay. All right. Do you have any difficulty in vision?
No, I feel sometimes it is blurred. My vision is blurred. But
Okay. Okay.
yeah.
Do you feel difficulty when you go into the light?
Yes.
More
Yes.
pain. Okay. All right. All right.
Yes. Yes.
Okay. Do you have any cough or any chest pain or breathing?
No.
Okay. Do you have any chest pain at rest, or do you have any racing or pacing of your heart?
No.
Okay. Did you notice any frothing of urine or swelling of your legs apart from the joint swelling?
Oh, no, doctor. I'm not having any like frothiness in the urine, but I'm having some discharge uh, from my urethra.
Okay. Okay. So, all right. Do you know the color of it?
It is whitish.
Whitish. Okay. Any pain while passing urine?
Yes, it is difficult to pass the water work, doctor.
Okay. Since when is this?
It is also for 2 to 3 weeks now, doctor.
Okay. All right. And uh, do you have any associated loose, any loose stools?
No, right now, no loose motions, doctor.
Okay. Okay. All right. So I want to ask you personal questions. Do you smoke?
Yes, doctor, I do.
Okay. How many sticks a day?
It is 7 to 8 or sometime 10 in one day.
Okay. And since how many years are you smoking?
Almost 10 years, doctor.
Okay. I would like to suggest you that smoking is injurious to health, and I would suggest you to stop smoking. We would help. We can, if you're interested, we can arrange a meeting with this appointment with the smoking cessation clinic that so that they can help you with that. Is that okay,
Uh,
Mr. Clark?
Okay, okay. Thank you, doctor.
Okay. Mr. Clark, do you consume alcohol?
Yes, doctor, only over the weekend, 1 to 2 units.
All right, all right. Okay. And I'm sorry to ask, do you use any party drugs?
No,
Not at all. Okay, thank you. And who do you live with?
I live with my wife, doctor.
Okay, I assume she's a long-term partner. And sorry to
Yeah.
ask, do you have any casual partners?
No, doctor.
Okay, okay. Sure. Mr. Clark, do you have any family history that I should be aware of?
Yes, my brother is having ankylosing spondylitis, doctor. He is on
All
treatment.
right, all right. Okay, how is he doing now?
He is okay with the medicines.
Okay, okay. So, right now you're living at home, and what do you do for your living?
I'm a school teacher, doctor.
Okay, how is the symptoms impacting your life, daily life?
Yes, it is really affecting my daily activities, doctor. I'm just like limping on my right knee because of the pain and the swelling, and difficult to drive also.
I'm so sorry. I think since your symptoms are still getting, we'll figure out the cause, and since we after the symptoms resolve, I think till then you should refrain from driving. And
Okay,
uh, can I examine you?
sure.
Okay. So, in for the general physical examination, I look for pallor and I look at this rash. I see there are
From where you will
vesicular.
start the exam? From where you will start the exam?
I'll start from the hands. I mean, for this case,
Okay,
generally I'll start from the hands only, doctor. Sir.
okay.
Okay, so I'll inspect the hand first. So I'm seeing there are vesicular lesions over the palms, which are crusting, and there is some serous fluid in that.
Mm-hmm.
And uh, uh, uh,
Yes.
okay,
What you
and
will do next?
I look for any deformities and
No deformities in
any.
the hands.
Okay, and any joint tenderness of synovitis?
No,
No tenderness over the MCPs and the metacarpophalangeal joints and the proximal interphalangeals and wrist joints.
no,
Okay, and I look for any tenderness or nodules in the elbows.
no, no nodules.
Okay, and I look at the knees and the ankles and the feet. So for I look for the swelling.
Okay, this is the knee.
Okay, I'll generally look for warmth around the knee. I see there is a swelling around the right knee.
Mm-hmm.
I would not look for a deep tenderness. I'll generally look for warmth. And
Okay.
I is there warmth, sir?
Yeah, it is warm and slightly you can see the soiling is more swollen
Yes,
more than the left knee area. Yeah.
yes, yes, sir. And we're looking at the feet again. I had seen that there are raised lesions, uh, hyperpigmented papular lesions over the feet. I look for any tenderness or warmth around that area.
Okay.
Is
Which
the
area you want to check the warmness?
over the feet, sir? Over the sole of the feet, over the lesions.
Yeah, only the left ankle area is slightly warm and swollen also.
Okay, sir. So I look at the eyes for any. Yeah, there is inflamed conjunctiva,
Yeah.
and that's so there is the very around the around the cornea. It is actually there is some sparing also.
Okay,
Of,
3 minutes remaining.
okay, and I look for any mouth ulcers.
No mouth ulcers.
Okay, I look for any palpable lymph nodes in the cervical area,
No.
and um, I'll I'll do a focused examination of the chest and the chest to look for any pleural rub.
No pleural rep.
Okay, and I'll do a focused examination of the abdomen to look for any hepatosplenomegaly.
Okay, no splenomegaly, no hepatomegaly. 1 minute remaining now.
All right. So, Mr. Clark, do you have any concerns?
Yes, doctor, what is wrong with me?
So, from what I understand from your history, from your symptoms and the examination, I think that you're suffering from an infection, and that has caused infection in your urinary, in your waterworks, which is
Okay.
causing an inflammation, uh, uh, which is causing soreness in your joints.
Mm-hmm.
So that is, uh, in medical terms, we call it as reactive arthritis.
Okay.
You'll need some medications for the pain control, and the swelling will come down with that. And you need antibiotics for the infection. So with the right
Why
treatment,
I developed this infection, doctor?
uh, so uh, it is
Or
possible
the
that
Yeah, why I developed this joint swelling, doctor?
with the infection, uh, the defense system in your body, it actually overacted in a dysfunctional way, so that it
Okay.
has caused soreness in your joints.
Uh-huh. So right now I'm having infection in my waterwork and the infection in my joint.
No, there is no infection in the joint as such. The infection
Okay.
is only in the waterwork, and that has triggered a dysfunction in your defense system that has caused the soreness in the
Okay.
joints.
Okay. Is it something, doctor, to spreadable infection for waterwork?
Definitely. So waterwork infection can spread through sexual intercourse. So it is sexually transmittable. It could be a sexually transmittable problem. So I would
Mm-hmm.
advise you to use barrier methods while uh, uh, having intercourse, and screen your partner as well for infection for the same.
And what about my eyes, doctor? Why my eyes are swollen and red?
It is again the part of the disease process where your dysfunctional immune system, the dysfunctional this defense system is attacking your small, and that is causing the soreness there.
Okay. So what you will do for me today, doctor?
So I'll right now I'll give you medication for your pain control. I'll continue with the Brufen tablets for your pain relief, and I'll collect some blood tests and your urine tests for uh, looking at the infection. And
Mm-hmm.
I'll start you on an antibiotic that would cover for this infection, and I'll arrange a follow-up appointment with you to look to for you to for following up with the results, so that I can find the exact bug that is causing the infection, and with that I can give you the right course of antibiotics.
Thank you. Time is up. And give me 1 minute. I will join in 1 minute time. I have one call to attend. Okay. Thank you,
All
Dr.
right,
Manjar.
sir.
Thank you.
Thank you, sir.
And also, colleagues, please give me 1 minute. Thank you so much. Yes, Dr. Jim.
Yes, sir.
Yeah. So, what is your differential diagnosis in this case?
So in this gentleman, I would consider the diagnosis of reactive arthritis secondary to urethritis.
Okay.
I would also consider an
Is it
evolving.
urethritis? Is it urethritis or urinary tract infection?
It is probably an urethritis, sir.
Okay. And why he is developing the reactive arthritis? With UTI, he's developing the UTI, with UTI, he's developing reactive arthritis.
Sorry, sir.
Reactive arthritis occurs with the infection together.
Yes, sir.
Is it occurring at the same time or it is occurring after the infection?
It is usually after the infection, sir.
So if he is having UTI right now, so it should not be reactive arthritis.
Uh, so, I mean, he has a triad of conjunctivitis, urethritis, and arthritis, sir.
Yeah, this is the triad of the arthritis, conjunctivitis, and urethritis. Okay. My question is, usually the reactive arthritis comes after 2 to 3 weeks or 4 weeks after the infection. Okay. So
Yes, sir. Yes, sir.
the urethritis, he is having urethritis now, conjunctivitis now, and arthritis now. These three are present in this patient, but not the
Yes,
UTI.
sir.
How to differentiate urethritis from UTI in the history?
So, UTI, they'll have more of lower urinary tract symptoms of increased frequency of micturition and pain, burning sensation while micturition. Urethritis will have more of a discharge from the urethra, sir.
Yeah, but this patient is having what type of discharge?
Urethritis kind of a discharge, sir.
It is whitish discharge, he told you.
Yes, sir.
Is it pussy discharge or no? It is not pussy discharge.
Uh,
Okay. Is it
yeah,
not
I
the
think.
colored discharge? It is whitish discharge, I told you.
Yes, sir. Yes, sir.
Okay. Right. How the reactive arthritis occurs, after which infection it is occurring?
Uh,
It is occurring either after the GIT infection or after the sexually transmitted infection. Okay.
yes, sir. Yes, sir.
So you have to ask in the history, did you have any infection in the recent past? This was missing in
Okay.
your history.
All right. All right. Yes, sir. Okay. Okay.
Okay. Four
Yes, sir.
weeks ago, 4 weeks ago, he had food poisoning.
Okay. Okay. Okay.
Okay. You did not ask about the travel history. You took the brief sexual history, that is good. Okay. But you did not ask about the travel history. You did not ask about the dietary history also of this patient. Okay. So
Yes,
four
sir.
weeks ago, he traveled somewhere with his friends, and they took the dinner from outside. Okay. And
Okay, sir.
uh, yeah, everyone developed the gastroenteritis. They developed the loose motions and vomiting also. So all of
Okay.
them,
Okay, sir.
after taking the course of antibiotics, these symptoms improved, and he's not recognizing or remembering those symptoms now. But
Yes, sir. Yes,
if you
sir.
are thinking about the reactive arthritis, when it comes to in your mind that it is the case of reactive arthritis, you should go temporally. Okay. You should
Yes,
go
yes, yes,
behind
sir.
and you
Yeah,
have
I
to ask
understood,
the
sir. Yeah.
patient. Yeah. Then you have to ask the patient, do you have any infection or bug infection in the recent past, like 1 month ago or 1.5 months ago? Clear?
All right. Yes, sir.
So once you make the diagnosis of reactive arthritis, you have to think about two type of infection, either GIT infection or the urinary tract infection or sexually transmitted infection. Okay,
Yes, sir.
so these should be in your history, part of your history. So if you would have asked me this, I would have told you that I had 3 weeks ago or 4 weeks ago. We went outside and we took food from outside. Okay, it was the street food, and everyone with my friends, I went to went outside. So I developed the loose motion, and everyone developed the loose motions and vomiting. And it stayed for us for like 5 days, and we took the course of antibiotics, and everyone improved. Okay.
Yes, sir.
Also, I
Yes, sir. I should
improved
have asked
from the
that. Yes, sir.
GI. Yeah, so I also improved from the GID symptoms, but after 1 to 2 weeks time, I'm noticing that I'm having the joint pain, I'm having the rashes, I'm having now this eye symptoms also. Okay.
Yes, sir. Yep. Mm-hmm.
So in the history, the sexual history is you took, and whom do you live with? Okay, and travel history. Where did you go? Okay, did you go abroad?
Yes, sir.
Yes. And what was the reason of this traveling? May I know? So politely you have to ask. And was it a like a business trip or some enjoyment trip? So and you were accompanied with your friends? Yes. So where did you stay, and from where you took the meal? What about the water? Did you take the safe water? Was there any food from the street? So these are the questions that you have to ask. Okay. And
Yes, sir.
whom do you live with? Yes, I live with my wife. So during your trip, did you have any casual relationship? Okay. So these are
Yes,
the
sir.
questions. If yes,
Yes,
then
sir.
you have to proceed and you have to ask further question. Was it protected sex or unprotected sex? Okay.
Okay.
So these are the
Yes, sir.
questions. Accordingly, you have to proceed.
Yes,
Clear?
sir.
Okay, so these are the
Yes.
positive finding in this patient. The patient was having 4 weeks ago, he was having the gastroenteritis, and then
Yes, sir.
he improved. And then for last 3 weeks, he is having the joint pain with rashes and with the eye redness. Okay,
Yes,
and
sir.
together with
Yes.
this is having the features of urethritis.
Yes, sir.
Urethritis he is having right now. He's not having the burning exudation, but
Yeah,
he is
yeah, yeah.
feeling, yeah, he is feeling pain while he is passing the water. Okay,
Yes, sir.
so and what is the color? What is the color? If it is whitish, then it is against another like the sexually transmitted infection. Then you have to ask about, did you notice any rashes on your private part? Okay,
Yes, sir.
so
Yes, sir.
circinate balanitis can also be there, and during your examination, you have to inform the examiner that I would like to examine the genital area of this patient.
Yes, yes, yes.
Okay, so these are the important questions. And further question you have to ask, like, did you notice any lumpy swelling near to your private area? Okay, so these
Yes,
are the
sir. Yes, sir.
questions.
Yes, sir.
It means you are
Yes, sir.
trying to rule out this sexually transmitted infection and
STD. Yes,
UTIs.
sir. Yes,
Yeah.
sir.
So what could be the other differential in your mind in this patient? He's having lower back pain also, and he's having also hip pain also.
So, I could think of spondyloarthritis because his brother is suffering from ankylosing spondylitis.
Yes.
Uh, that is one possibility with the joint pains alone,
Okay.
and UV and I could also think of a arthritis, arthritis
Not
that's
viral,
happening.
septic arthritis.
Septic. Okay, yes, sir.
Okay. What else?
And again, connected to septic arthritis, infective endocarditis is a possibility.
Oh, no, no.
Yes.
If you are thinking about infective endocarditis, then you should examine also for, there should be high-grade fever in that condition, and there should be palpitation, there should be some other symptoms also, and there may be some findings like Janway lesion and other things that you have to search. And then
Yes,
your
sir.
examination
Okay.
should also include the cardiac murmur you are searching for that. Septic
Yes,
arthritis,
sir.
yes. So this patient is having oligoarthritis, isn't it?
Yes, sir.
2 to 4 joints. Okay, so it is oligoarthritis. So you can include the differential diagnosis of oligoarthritis. Okay,
Okay. Yes,
so
sir.
in so the first differential you can include like other seronegative spondyloarthropathies like ankylosing spondylitis, psoriatic
Right.
arthritis, enteropathic arthritis, septic arthritis, gout and pseudogout, and gonococcal
Yes, sir.
arthritis. Okay,
Yes, sir.
this these should be your differential in this patient.
Yes, sir. Okay.
Okay. So if you are
Yeah,
explaining
even
to the patient,
other connective tissue disorders also like uh,
you
uh,
can
uh,
you can include, but these are the must differential that you have to include.
yes,
Okay.
sir.
Then if you will
Yes.
include the other rheumatological condition, then there will be questions, and you have to say these are not present, these are not present. Like if you are saying about rheumatoid arthritis, so it is not symmetrical small joint polyarthritis. It is not.
Yes, sir.
Okay.
Yes, sir. Yes, sir.
And Usually it affects the metacarpophalangeal and the proximal interphalangeal joints and the wrist joint. But in this patient, these are not involved. And like this, you have to proceed. Okay. Then you can, if you're thinking about other rheumatological condition, again, you have to rule in and rule out the symptoms. So we need like 4 or 5 differentials, good differential from high likely to less likely in the exam.
Yes, sir.
Clear?
Yes, sir. Yes, sir.
So now again, I'm a patient, and how you will explain to me the reactive arthritis.
Sir, okay. Mr. Clark, so, should I ask the history now, sir, regarding the past?
No, 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 done. That is done. Now you have to explain
Okay.
the reactive arthritis only to me.
Okay. Yes, sir. So, Mr. Clark, so you mentioned that you had a infection while with the bug
Yes,
infection after
yes,
traveling 4 weeks back. So,
yeah,
the infection, even though the infection had gone away, that had triggered uh, the activation of uh, triggered an activation of the dysregulation of your defense system that has caused problems in your joints, eyes, and even in our waterwork area. So
yes.
that is causing the swelling in the joint and the redness in the eyes and the whitish discharge that you mentioned from the from your waterwork.
Okay. So now again, I will ask you, is it contagious disease, doctor? Is
Right
it
now,
spreadable?
it is not a contagious problem since it is not an infection. It is
Mhm.
your body's defense system's
Overactive system,
problem, overactive
overactive
system that is
defense system.
causing the problem. So with the
Okay.
medication that will
Short
reduce
answer.
the,
Short. Yeah, short answer you have to give. Okay.
yeah,
Will this condition be permanent, doctor?
usually this condition is a transient period and it will resolve within a period of weeks and it should not occur again.
Okay. And right. Okay. So now the further question of the examiner. So what investigation you will do for this patient?
So I'll do a full blood count to look for any leukocytosis. I'll look at the urine examination to look for the pus cells and urine culture. Um, and I'll look for I'll do X-rays of the knee and the ankle joint, and if possible, with the clinic. I mean, I'm not sure whether I have to do a synovial fluid analysis here because
Okay.
the clinical
Okay. What is the diagnostic test for reactive arthritis?
uh, it is a clinical diagnosis.
Yes, yes, yes. So speak confidently. The diagnosis is clinical based on the triad of arthritis, conjunctivitis, and urethritis following an infection.
Yes,
Okay.
sir.
But I
Yes,
will
sir.
do the baseline investigation. What is the baseline investigation? I would like to do the full blood count. I want to check the anemia of chronic disease. Together with this, I want to check the uh, kidney functions. I want to check the liver function. I want to check the ESR and CRP, and that
CRP
most likely
inflammatory markers. Yes.
will be elevated. Okay.
Yes.
Then the
Yes, sir.
rheumatological immunological investigation, like the rheumatoid factor, that I'm expecting that it will be negative or positive rheumatoid factor.
Negative, sir.
Okay, what about NTCCP and what about HLA-B27?
So that also should be negative, sir.
No. HLA-B27 will be positive in
HLA-27
30
can
to
be positive, but yeah, in majority of cases it could be
yeah,
positive, sir.
yeah. So
NTCCP will be
rheumatoid
negative.
factor and the NTCCP will be negative. Then the
Negative, yes, sir.
infection screen. So you have to divide into three screening or three types of investigation. First is the baseline investigation and inflammatory marker. The second is immunological investigation, and the third one is infection screen, because we have to think about the infection still, right? So infection
Yes, sir.
screen, what investigation you will do?
Uh, Again, I'll look at the blood counts and look at the culture and NAT test of the urine
Mhm.
for looking at
So
chlamydia and and also a stool
Yeah.
culture.
Yeah. So you still have to take the history of loose motion still he is having or no? Okay. Then if
Yes, yes,
the stool is, even if the stool is normal, you can think about the stool analysis in the stool for culture for
yes,
Salmonella,
sir.
Shigella, and Campylobacter and
Yes,
Yersinia.
sir.
For
Yes, sir.
urethra, for the urethral discharge, you have to take the urethral swab for Chlamydia trachomatis. PCR you can
Yes,
do,
sir.
and urine
Yes, sir.
analysis you can do, and urine culture you can do.
Yes, sir.
Okay, but you have to say that most likely it will be negative.
Yes, sir.
Okay, and then the other investigations will be including the X-ray of the affected joints and the sacroiliac joint.
Yes, sir.
Okay, how you will manage this patient?
So, if then infection was positive, then I'll treat the infection. For chlamydia, I'll give doxycycline or azithromycin. And for primarily, it is symptomatic relief. For the joint pain, I'll give NSAIDs. And if not relieved with that, I can give short oral corticosteroids or intraarticular steroids.
Okay, is there any
And
specific treatment for this disease?
no, sir. It is symptomatic relief, and I'll involve the multidisciplinary team to involve the physiotherapy and occupational therapy for
Wait, wait.
his.
Yeah, yeah. Just do the, you have to give the answers specifically. Okay, right. So, when to give the intra-articular steroid injection?
If it is not relieving with NSAIDs, and if there is severe pain or swelling, so severe synovitis in the joint.
Okay. Any other medicine, any other things you can do if the symptoms are persisting?
Colchicine is another drug that can be given.
Colchicine? No colchicine.
Not sure. No, okay,
Yeah,
okay.
right. Okay.
Other DMARDs can be tried, sir. So
Okay.
like
When to try?
sulfasalazine.
When to try?
If it is persisting, sir, if it's a chronic symptom, if the joint pains persist,
Okay. Okay. What will be your multidisciplinary team in this patient?
so I'll involve the orthopedics doctor, and I'll involve the physiotherapist and the occupational therapist
Mm-hmm.
and ophthalmologist for the conjunctivitis.
Yeah.
But um,
You will involve the orthopedic or you will involve the rheumatologist?
rheumatologist.
Who will be the leading person in this case? Leading doctor?
Uh, uh, Rheumatologist, sir.
Yeah. So the rheumatologist will be the lead, GP on board, physiotherapist, occupational therapist, podiatrist, ophthalmologist, urologist if genitourinary is suspected. Okay. If persistent
Okay, sir.
urethritis is there or sexually transmitted infection is there, then a specialized rheumatological nurse. These
Yes,
are
sir.
your, okay. Okay, I will summarize the management of this patient and then it is done. Uh, okay, so the non-pharmacological management in this patient, here we have to give the rest to this joint. Sometimes we have to apply the splint also for a few weeks time, okay, because it is acute arthritis.
Okay, sir.
Okay, so we have to apply the splint, okay, and we have to refer then we have to refer this patient to the occupational therapist and the physiotherapist for ads and adaptation. Okay, and there is no
Okay, sir.
specific treatment. There is no specific treatment for this disease, but NSAIDs we will start with like the naproxen for the pain and inflammation. Okay, and if it
Yes,
is
sir.
not responding to the NSAIDs, then we should think about local steroid injection to the affected joint. Okay, if not
Yes, sir. Yes, sir.
responding, if not responding, we can think about systemic steroid. If not responding, then we have to think about DMARDs. In the DMARDs, we have to include either sulfasalazine or methotrexate, and it is indicated for persistent reactive arthritis or severe reactive arthritis. Clear?
Yes, sir.
And finally, the anti-tumor necrotic factor medicine, adalimumab, it is indicated for severe reactive arthritis that is resistant to DMARDs also.
Okay,
Okay.
sir. Okay.
Okay. What is the prognosis of this case?
It is usually a self-limiting condition and needs only supportive treatment. And uh, usually the symptoms resolve over a period of weeks, sir.
Not over the periods of weeks. It is the periods of months.
Okay, okay, sir.
Okay. And we should say the prognosis is generally good. Most patients recover fully within the period of 6 to 12 months.
Okay, okay, sir.
15 to 50% patient can develop chronic reactive arthritis. If they persist more than 6 months, then it will be known as chronic reactive arthritis.
Okay, okay.
Okay. And the poor prognostic factor is if the HLA-B27 is positive and if the patient is having severe arthritis at the start. These are the two poor prognostic factors.
Okay, sir.
Clear? What could be the complication of this reactive arthritis?
So
Chronic reactive arthritis. Chronic reactive arthritis, as I told.
yes, sir. Yes, sir.
Okay. And then recurrent episodes can occur.
Yes, sir.
Okay. If it is persisting, then joint deformity can occur.
Yes, sir.
Okay. Then this patient is having chronic, he is having the pain lower back area that can persist, and chronic low back pain can persist over there. He can develop the anterior uveitis. Okay.
Yes,
So
sir.
these are the these are the complications of the disease.
Okay, sir.
Any question from your side?
No, sir. Thanks so much. And why did you say, sir, blurring of vision sometimes?
Yeah, yeah. He is having blurring of vision. Yes. Conjunctivitis he
Usually,
is having. He is
okay,
having
because of the
conjunctivitis.
excessive discharge, probably, sir. I mean,
Redness, because of the redness and uneasiness, he is feeling discomfort. He is feeling because of this, and sometimes the painful eye movement is also there, and blurry vision
okay,
is also there. Okay.
okay, okay, sir.
What is the most serious extra articular manifestation of reactive arthritis? This is another
Sir,
complication also. This is the
sir,
anterior uveitis.
anterior uveitis, yes, sir.
Anterior uveitis. Okay. So this is the
Okay,
most
sir.
serious extra-articular manifestation. We have to give the patient warning. If you develop painful red eye with blurring of vision or photophobia, you must immediately come back to the emergency department and you should go to
Okay,
the ophthalmologist. It may threaten
okay,
to
sir.
your eyesight. It may threaten to your eyesight. You have to inform this.
Yes, sir. Yes, sir.
If patient develop this anterior uveitis, then they will give the steroid eye drops to this patient.
Okay, sir. Yes.
Okay, in the sequence of your examination, I want to give you the feedback about your examination pattern. So when you started, okay, I will accept that you started with the hands. Okay, so this patient is having multiple areas findings. Okay, the
Yes,
findings are
sir.
present in multiple areas. So
Yes, sir.
you have to reach to the presenting area where the presenting complaint is as soon as possible, and you have to focus there. Okay, and then
Yes.
the other areas you can just touch and go. Okay, so
Okay.
which part of
Okay.
this patient is mostly affected, or what is the presenting complaint?
So knee and the ankle,
Knee and ankle. So you
sir.
have to,
Yes.
yeah, you can start with the general inspection. Okay, then you can see the hands of the patient, and you can see the eye of the patient, then directly go
Okay.
to the knee of this patient. Okay,
Yes, sir.
general inspection, then hand examination. You can see any rheumatological type of inflammation is there in the joints or no, any rheumatoid nodules are there or no, any wasting or
Yes.
there is no, any ductilitis is there or no, any nail changes for psoriatic is there or no. Okay, so these are
Yes, sir.
important points. Then this patient is having rashes on his palm, vesicular rashes. That can be also, you can see the reddish at
Yes,
the
sir.
periphery. Okay, and reddish at the periphery. At the top there is just like a scrub, but this is not the pus. This is just like a scrub. Okay, you should ask the
Yes,
question:
sir.
is it painful? Is it itchy? Uh, is it oozing or no? These are the questions that you have to ask. Is it increasing since it come? Is it coming and going? It is first time you are having. These are the questions for the rashes you have to ask. Okay, after the
Okay,
hand
sir.
examination, you can go to the eye examination, then try to reach to the knee of this patient as soon as possible. You have to expose the knee, you have to inspect the area, you have to compare with the other side. Okay, like in
Okay.
this patient, if I will reach over there, so I can see that the right knee is swollen as compared to the left knee. If you see
Yes, sir.
this area is full. If you see this is normal. Okay, this is full. Okay, and this side
Yes,
also,
sir.
as compared to the left side, it is full. Okay, then you have to see it is swollen. It is clearly swollen, but it is not so much reddish. What do you have to do? You have to touch our this area, our this area, our this area, and then our this area and down area. So with your two hands, you will put over the upper part of the thigh. Then both hand you will put over the knee area. Then two hands you will put down near to the shin area to compare the temperature in different parts, three different parts simultaneously. Okay, you will feel it is warm. Okay, then you have to ask the patient, are you feeling pain? Can I touch it? If the patient says no, doctor, it is okay, you can touch it. So you can touch it before touching, but you can ask the patient, can you like bend your knee up and down? Okay, and then what position patient is there? If the patient is sitting on the chair, then okay. If the patient is lying on the bed, then you have to see what position the patient is having. So you have to ask the patient to flex the knee and extend the knee by himself. Okay, at the same time, then you will ask the patient flex and extend your uh, ankle joint also. Okay, then you have to see, look, feel and move, look, feel and move, and the patient will move first and then you will move it. Okay, if it is painful, then you will not proceed, and you have to see the face of the patient and you have to inform the patient, I'm going to do the movement with my hand, but I will do it gently. If you feel any pain, let me know. Okay, if the patient feel pain, you immediately stop there and you will inform to the examiner that the condition is painful, this the movement is painful, so I should avoid this. Okay, so this is how we have to examine the patient. Then you can ask him, can you walk for me? So you will see how he's walking. He must be limping on his side, on that side. Okay, so these are the important points: look, feel and move in the rheumatological condition. That's all about this case. Any question from the audience?
Thank you,
We
sir.
have to do this modified Schober test also in this patient. Okay, and yeah, because the patient is having this one, the lower back pain also, and he's feeling pain also over the hip area or the buttock area. So it is significant that you have to inform that one of my differential diagnosis is ankylosing spondylitis. So I would like to do the modified Schober test. So then you just highlight these points if you do not have the enough time uh, that to the examiner that, sir, I want to do the three tests for the ankylosing spondylitis. What are three tests you want to do? So wall occiput test, chest expansion, and the modified Schober test. You can say like this. So they will mark it that you know this and you want to do it, but the time is limited. Okay. PACES disease could be one of the differential, yes, but you have to ask about the oral source and the source in the private area. These will be the painful source. Urethral swab is yes, there's a good investigation. Poor prognostic factor in this patient is if the patient is having HLA-B27 positive and if the patient is having from the start severe reactive arthritis. X-ray finding will be just like inflammatory changes over there. Okay, there will not be any joint destruction. There will not be any joint destruction at the earlier stage. Yes, we have to check the mobility, Dr. Manesh. Yes. Look, feel, and move. Yes, we have to do the Schober test. Travel history is very important. In general, how important it is to do the fundus. Here, the fundus is not very important. You have to check the visual acuity because the eye at rest. So what you will just in front of the patient, you will count the fingers. Can you count the finger? How many fingers in front of you? So two fingers. Then on the other side, please close one eye and you have to count the finger. That's it. Okay. Lymph node examination. Yes, you can inform the examiner that I would like to check the lymph node examination, especially the inguinal area. Investigation of reactive arthritis, I think I recap already. Baseline investigation, X-ray of the affected joints, immunological investigation, and infective workup. Okay. Yes, hypothyroid, yes, could be there, but in general, for all cases, do we carry ophthalmoscope? No, we don't carry the ophthalmoscope. They will provide you. It will be in the on the station. Okay, you have to carry only your stethoscope, and if you have the torch, that will be good. These are the two things you need. All other equipments they will provide you. But if you are familiar with your fundoscope, then better you should take your fundoscope with you. So these are the important messages. Okay. If you people do not have any further question, then we'll proceed to the next case. Okay, so I will give you the feedback about your performance, Dr. Jim. So physical examination was borderline. Identifying the physical sign was satisfactory. Clinical communication is deficient. I will say it is borderline. Differential diagnosis is good, satisfactory. Clinical judgment is good. Managing the patient concerns, you should start from the welfare. Managing the patient welfare, Dr. Jim, you should start when any patient who is presenting to you with the pain, you should offer the painkiller, and it will be the good sign for the managing the welfare of the patient. Okay, patient concern you did. Okay, so satisfactory here, satisfactory here, satisfactory here. Differential diagnosis satisfactory here. Clinical communication skill in the histories it was borderline, I will say, because your history should be improving. Identifying physical sign is good. Physical examination was borderline because it was not systemic. It was not smooth. Usually the patient give you 3 to 5 concern, and it depends how fast you completed your things. Okay, if you have done everything on time, you will face 3 to 5 concerns, minimum 3. If you are facing less than 3, it means you are late. Okay, so 3 to 5 concern will be there. Yes, Dr. Jim.
Okay, sir.
Any question from your side?
No, sir. That's a good case, sir.
So
Thank you.
yeah, so you found your feedback also,
Yes, sir.
right?
Thank you.
Thank you. So these are our courses that is available right now. You can do 20 long cases and 20 communication cases, total 40 cases in 7 sessions. And this is our, if you want to join group, you can take this barcode. And this is our another course, 35 long cases and 35 communication cases. Total 70 cases. And I will suggest this is for those candidates who are near to the exam. Near to the exam, if they are doing these 70 cases, they will be having very good preparation for their upcoming exam. Okay, so Dr. Sarwat is around.
Yes.
Okay, this is your case, Dr. Sarwat. And we will
Okay,
start in
thank you.
5 minutes. Yes, you can start.
Okay. Hello. I'm Dr. Sarvat. I'm one of the doctor here. Am I talking to Miss Lara, 30 years of age?
Yes, Doctor, I'm Lara and I'm 30 years old.
Okay, Miss Lara. We are here to discuss about your results, and I will answer your concerns. Is this okay to you?
Yes, Doctor.
Okay, Miss Lara. So far, do you have any idea about what is the condition you have?
Yes, Doctor, actually, I'm joining my new job and they did the investigation as a routine they used to do. As a part of this investigation, they told me that they have to do the jelly scan of my tummy. And after doing this jelly scan, they told me that you should go to the kidney doctor. So they are telling there are some changes. I don't know exactly. And that they told me that you will explain me here in your clinic. So I'm here to know what is going on.
Okay, Miss Lara. I'm thankful for your visit in the kidney ward. Miss Lara, what are your expectation about today's meeting?
I want to know everything about my problem, doctor, and I hope it is something simple thing and I can continue my job.
Miss Lara, I'm afraid that it might not be a good news for you.
Why, doctor? Is it something serious?
Miss Lara, actually, your jelly scan that was done for your job suggested shows that you have some packets filled with the water in your kidneys. In medical term, it is called the polycystic kidney disease. I'm sorry to use
Mhm.
this medical term. Have you ever heard about it?
No, doctor, I don't know about this term.
Okay, so Miss Lara, look at the picture. Actually, look at this is the kidneys, and in the kidneys, usually there are no any such packets are there. But in certain pupils, due to some of the genes problem, there is development of some pockets filled with some water, and
Mhm.
these packets will then grows with time, and they will affect the kidney functions. Are you with me, Miss Lara?
Why? Yes, yes, yes. And why I developed these pockets, doctor?
Miss Lara, actually, as I told you, this is the problem that occurred due to some inheritance. It runs in the family.
Mhm.
May I ask, do you have any such history of in the family, any
No,
kidney
doctor,
disease in your family?
my parents are okay, doctor, and nobody having such condition. So how you say it is inherited condition?
So in some cases, it may occur abruptly. I mean, there is some genetic changes in your in the development, so it leads to this problem. I'm really sorry.
Uh,
I'm the one who's telling this.
okay, so doctor, what I have to do now?
Miss Lara, as you have the cyst in your kidneys, this the polycystic kidney disease is usually is not a treatable condition, but we can manage it.
So what are the bad effects if I'm having this, doctor?
Miss Lara, as these cysts usually not present in the kidneys, once they are developed, they are increasing with the time, and there may be the chances of having the kidney dysfunction, as well as they might rupture and lead to bleeding within your waterworks, and
Mhm.
it may lead to some of the infection within your tummy, and the one of the more important thing is the raised blood pressures along with this, and there are certain cysts along with the kidney. There are other organs in which there might be the presence of kidney cyst packets filled with the water, like in the
Mm,
liver,
mm.
and
Okay.
also it might be the possibility to present in your brain as well.
Okay. Doctor, really, it is a shocking news for me, and you are telling that it is a serious thing and then it has got a different repercussion on my body. So, do you think
Yes.
it will affect my life expectancy?
Miss Laura, well, actually, it's a manageable condition, and once you are going to have a regular follow-up with your kidney doctor, and you will have to control your blood sugar, blood pressures, and you will follow the instructions of your kidney doctor. Then you may have the uh, near normal life with this
Will I
disease.
will I will I land up with the dialysis or kidney failure, doctor?
To be very honest, Miss Lara, with you, there are the chances of having this problem because, as I told you, the cyst increasing as the age. With the age, and there is a chances of having the kidney failure, and
Mm.
then ultimately there is a chances of having the dialysis as well.
Is there anything you can do for me, doctor, to prevent me from having this kidney failure?
Yes, what we can do is we can have the management of your, blood pressures, as the blood
Mhm.
pressure is the major cause of having the problem in the future. So we're going to monitor your blood pressures regularly, and if need, then we have prescribed some of the medications that help in controlling the blood pressures, as well as they halt the process of kidney deterioration.
Uh-huh. Okay, doctor, you told me that it is an inherited disorder. So I'm living with my partner and we are going to start the family. Is it likely that it will be affecting my children?
Yeah, there may be the chances of affecting your children's. Your pregnancy must be planned. Okay.
Any chance can I prevent my children, doctor, by any way?
Yeah, there are the some methods available, as there are certain methods in which we can identify during early pregnancies by having some testing that whether your child is inherited that gene or not,
So if it is inherited, then
and
what
for
you will
which
do?
I will. If the your child has inherited the gene, then your woman doctor will guide you more further about it. But
Mhm.
usually, then we have to then do not allow the pregnancy to be continued in that case.
Oh, okay. So is there any chance, doctor, to prevent such type of pregnancy should not happen?
Well, as I told you, your pregnancy must be planned, and for which you have to follow your woman doctor about this. And to prevent this, you have there is no any chances of getting the prevention. But what we can do is, once you found the news of the pregnancy, then the
Two
test
minutes
must be
remaining.
done, and we can identify.
Okay,
Okay.
two
Do you
minutes
have any
remaining.
concern, Miss Salara?
Yes, doctor. I'm worried about my relationship with my partner. We are going to marry soon. So, would you please not tell to my fiancé, doctor? Don't disclose this
Uh,
news.
okay, Miss Lara, actually, this might affect your, the pregnancy. If you have the pregnancy, then you must be have a planned pregnancy, and there is no way to inform your partner at this moment. But it's better to tell by yourself, as it will increase your bonding to your partner.
Okay, doctor.
May I ask you some questions, sir? Do you smoke?
Yeah. Yes.
So, Miss Lara, smoking is really hazardous for your general health, as well as for the your kidney as well. It will increase the chances of blood pressure. So I'll suggest to please stop the smoking. And if need
Okay.
any help, I'll arrange a meeting with the smoking cessation clinic. Do you need any? Do you drink alcohol?
Yes, doctor. I drink only over the weekend, 1 to 2 units.
Okay, I suggested to please cut down your alcohol intake because it also be responsible for increasing some kidney derangements. Okay, and I'm also suggesting to please avoid the some of the painkillers that are available over the counter and some over the counter medications because they might harm the kidneys.
Okay.
Okay. And for which I'm also I'm suggesting to please stop controlling your alcohol, your salt intake, because increased salt will increase the blood pressure, and then ultimately the kidney function will be deranged.
Okay, I will give you 1 minute more. Doctor, I'm a
Okay.
rugby player also. So can I continue my playing with the rugby?
Miss Lara, for which I have to consult to my consultant, and then we'll come back to you about this. But it's usually the main problem that occurring is due to the raised blood pressures. So we'll have to control your blood pressures. Then, if your pressures are controlled, then you might be able to play the rugby. But
2 minutes,
I'll
20
continue
seconds remaining.
this.
20 seconds, 20
Okay.
seconds more. Yeah.
Okay, I'm just giving you some of the leaflets and brochures for which you get more information about this. And in case if you need any more information, we can arrange another meeting for this. Is this okay to you?
Okay. Yeah. Thank you. Time is up.
Okay. Thank you.
Thank you. Good performance, Dr. Sarwat, in this scenario. Uh, there are some important points that I will highlight. The rugby playing is contraindicated in this patient. Any contact sport is contraindicated because the patient is having the polycystic kidney disease. So cyst can rupture. Avoid heavy exercises. Avoid the vigorous exercises. Avoid the contact sports like the rugby, football, boxing, and these type of things. Okay, so these all
Okay.
we have to avoid these. The second
Okay.
important point
Thank you.
is, yeah, the second important point is she is asking about prevention of the children and safe pregnancies. So you have to inform her that I will refer you to the woman doctor and to the genetic specialist. He will explain you the situation. Clear? So this disease can be prevented by pre-implantation genetic testing. Do you have any idea about it? Or any audience, they have the idea about pre-implantation genetic testing?
Sir, in that we usually do the like IVF, and after IVF we do a pre-implantation genetic testing and implant only those embryos who do not carry a,
Pre, yeah.
who
Yes,
do
yes,
not
you have.
carry a-
Yeah, yeah. Is it 100% successful?
uh, sir, I'm not
No,
sure.
I guess.
Yeah, it is also not 100%, but it is like almost near to 90%. It is very effective. Okay. And the second concern is Dr. Manish. What I was thinking. Yeah. Okay. So just skipped from my mind. Okay. Who is asking about? Yes, I will explain about the pre-implant genetic testing. What they have to do, they will retrieve the ova and they will take the sperm from the male side. 2 to 3 ova they will take from the female side, and those sperms from the male side. They will do the fertilization outside the uterus. Then they will do the genetic testing. They will see how many embryos fertilized. These embryos are disease-free or genetically they're not having the uh, autosomal polycystic kidney disease genes. So 1, 2, or 3, whatever it is, negative or not having this problem. So 1 or 2 they will implant according to the wishes of the couple. Okay. But we have to inform to them this is also not 100%, but it is near to 100%. It is not 100% secure. Okay, so this is the option by which we can prevent the any disease, any inherited disorder, not only in autosomal dominant polycystic kidney disease, but other scenarios also you can apply this. I think it's clear.
So, okay, thank you so much for telling this.
Welcome. Yeah.
Actually, will we have to explain this pre-implantation genetic counseling, or just we have to use the word pre-implantation genetic testing?
First thing is you have to inform the patient that I will refer you to the genetic specialist, and there is an option. There is an option, and you can have a preventable situation. Okay, her concern is, can I prevent my children? Yes, it is possible. Okay, this should be the answer. I will refer you to the genetic specialist. If the surrogate is
Oh,
asking you further question, it means the examiner have told to the surrogate that you have to ask this question. Otherwise, this will be enough to say that the genetic specialist will explain you, and there is possibility. Clear?
Sir, in this case, when the patient asks the question that will I need
Yeah.
dialysis, so but
Yeah.
we don't have a knowledge of patient's renal function right now. So
Yes.
if the creatinine is say 9 and urea is 190, 180, we'll say that you might land up very soon. We can say with and if the patient is having normal renal function, just diagnosed based on the stage of cyst, then we can say we can give a more conservative, like make it longer time. So how do we approach that when we don't know the other renal function of
Okay, for
the?
this you have to see the scenario again. What is the task? Talk to Miss Lara, explain the current situation, and inform about further follow-up and investigation plan. Okay. Here we have to be honest with the patient, and we have to be hopeful also to the patient. We have to inform that this is the diagnosis that has come up right now. And at the time of diagnosis, usually the patient is stable at this age. At this age, most of the patient, they are stable. They do not have high blood pressure, do not have the kidney failure. So what you have to say, we have to do further testing, Miss Lara, on you to see your baseline kidney function. I want to check your blood pressure, and I would to do further investigation for you. Okay, if you have normal kidney function, and I expect that you, because you should be positive also, so you will say that I expect that your blood pressure and your kidney function will be normal at this stage, because at the start of this disease, when we diagnose, usually the patient is not having kidney failure from the start. It is a long standing process, or it is a time taking process. So I hope that you will be having normal kidney functions. So what we have to do, we have to keep you in regular follow-up, maybe 6 months, every 6 months you have to come to the clinic according to your kidney function and according to your jelly scan finding and according to your blood pressure finding. What we have to do, we have to keep you under follow-up. We will do your kidney functions regularly, and I must ask you to check your blood pressure at home, and be you have to prevent yourself from development of the blood pressure. For that, you have to do like stop smoking, take the low salt diet, and you should do some moderate exercises, but not the aggressive one. Okay, and salt intake should be less, water intake should be more. So these are the important point, and we have to inform that with the proper follow-up, with the close follow-up, and if you follow our advices with the diet, with the activities, and with the blood pressure management, if you are not taking the nephrotoxic drugs, so all will prevent you to develop the end stage renal disease and its end stage kidney failure. So this is the way we have to approach to this patient. Is it clear?
Okay.
Yeah. And also, Dr. Sarvat, you also have to be like towards the positive side. So, what you, when she's asking, doctor, is it a serious condition? I appreciate your concern, Miss Lara, and your voice should be changed also with some sympathy and empathy. You have to explain to her, I appreciate your concern, Miss Lara, but don't worry that we are here to help you. We will be keeping you under follow-up. You are in the kidney clinic. Where you are? You are in the nephro OPD. Okay, so you have to see where is the location of the patient and you. So you have to inform that we will keep you under regular follow-up, and I will advise you, you should follow our advices, dietitian advises, our advices. You have to be prevent yourself from development of the blood pressure and derangement of the kidney function. If so, if you will follow our advices, you will remain like decades, many years you can remain near normal life without having the kidney failure. When I will develop the kidney failure, doctor, what is your expectation? So expectation is, I can appreciate your concern, and if you will follow our advices, you will remain for many years. You may remain without the need of the dialysis, and the dialysis we need when the kidney function is like 80% or more than 80% kidney functions are lost. So we will keep you under follow-up, and hopefully many patients, they live near normal life if they are following our advices. So like this, we have to approach. Clear? And better to say not the pockets, but you have to say fluid filled sacs. Fluid sacs. You have fluid filled sacs, not only in the kidneys, but there are risks that these fluid filled sacs can form in the liver and some other part of the body, like we say the pancreas and the thyroid gland. And sometimes you may have the ballooning out of the blood channel in your brain. This is very important that you did not touch, Dr. Sarwat. That if you develop anytime the severe headache, you must have come to the emergency department, and you have to inform to the emergency department that you are suffering from this disease. They will consider you, they will take you, and they know that what they have to do. They will do the immediately the imaging known as the MRA. MRA they will do. Okay,
Okay.
so this, yeah.
Okay. Okay.
And yes, another concern she raised, she told doctor, my family, nobody, my parents, they're not having this disease. So how I develop? So there are two answers for this. One answer is they might have, one of them might have the disease, but they do not have the significant symptoms. So we will do the testing on them also to find out whether they have any one of them having this disease or no. Sometimes the disease remains undiagnosed or disease remains silent. So it does not mean if your father or mother not having, so it is not the inherited disorder. So there is possibility, still there is a possibility. So further investigation also include this plan. The second possibility is in 1 in 10 cases, like 10% of the cases, they can have a spontaneous mutation. We say spontaneous mutation. You are the first person in the family who is having this disease. Clear?
Okay.
Yeah, so these are the two answers for this question. And then you have to inform that how many siblings you have, how many sister and brother you have. So anyone who is more than 20 years or 18 years, you have to do the ultrasound scanning for that. Okay, and the parents also. And for children, we already discussed. So for the partner, the fiancé, you rightly said that you should inform by yourself, and this is the confidential issue. We are not going to breach the confidentiality. This is our policy, and we are doing the according to our profession. This is our professional duty. We are not breaching the confidentiality. But I must appreciate you. I must ask you. You should inform from your side to your partner or the fiancé, because you are the partner, and you will be the future partner with him, and you are planning for the pregnancy also. So it will be daunting for him if you are not honest, if you are not telling from your side. But on the other side, if you need any help from my side, we can arrange another meeting where we can call your fiancé, and we can have a discussion with him, and we can explain to him what you are suffering from and what we can do, and how the life can be safe for you and for your upcoming children. I hope it's clear.
Yes. It's too much clear. Thank you so much. It's really good.
Thank you.
So
Thank you
many
so much.
things are
Yeah.
were not aware by me,
Yeah. No
especially the
problem.
rugby
It's okay.
player.
Yeah. Yeah. So these are the important points. And yeah, you are right that the pregnancy should be planned, and we will refer you to the woman doctor, genetic doctor, and you will be with the frequent follow-up. If you are going for the pregnancy, if the green signal comes from the woman doctor and genetic team, then you will be having more frequent follow-up than the usual one. Okay, if she is not going for pregnancy, then maybe 6 months once she has to come. But if it is in the pregnancy, maybe every month she has to come. And then what they will check, they will check the blood pressure and kidney functions frequently. Okay, because the pregnancy will also cause compression to the kidneys, and the kidneys are gradually increasing in size. Okay, and more important thing is that there are medicine also to decrease the progression of the disease. This will be decided by the multidisciplinary team. That is the tolvaptan we have to give, and until the late stage of the kidney function is lost, we will advise you to take the more water. 3 to 4 liter water you have to take, and this more water intake also decrease the progression of the disease. I hope it's clear.
Yes.
Okay, thank you so much.
Thank you
And
so much.
yeah, if you people are in my group, I will share this commentary also. I have the podcast on this topic. So just listen the podcast. You will have very important information over there. Go to the YouTube channel
That
with
will
the
be good.
pace. Yeah, go to the YouTube, write down PACES Pulse Academy, ADPKD. Okay, so you will see that there is podcast over there, and many of the concern and many of the informations very correctly given according to the UK guidelines. Thank you so much for joining today. I will end the meeting now.
Thank you so much for giving me the
You're welcome.
chance.
You're welcome. Okay, we'll download the session also on YouTube, and we'll inform you in the group. Good night.